But for purposes of the deposition, the doctor is certainly going to testify from them, and I'm reserving my right to object based upon foundation, lack of foundation, hearsay, etc.
Okay. All right. So, doctor, these two video clips you've already seen, correct?
Correct.
Okay.
This morning.
Excellent. So why don't you look at the screen and just describe for us this procedure, which I represent to you is a lumbar epidural injection.
I see a diagram of a person with two flashing red areas of basically the pain. Now it moves to the lumbar spine area where the shows the spinal cord and the dura along with the vertebral bodies and the spinous processes in the back and the epidural space. And then there is a needle coming, injecting some local anesthetic, I'm assuming, to numb the area. And then the epidural needle comes in. It's pressed under fluoroscopy to the epidural space, and dye was injected. It shows good spread of the dye in the epidural space. And then a syringe is attached, injecting the medication into the epidural space, and the needle was removed.
That's it?
That's it.
Okay, thank you, doctor. Let's go to the second clip.
Again is a skeleton diagram. It shows the cervical spine and facet joints, which it shows how the vertebrae rotate and move over each other and enable the neck to bend in flexion and extension and the rotation. And there is an area where the red mark on the video is, I assume they're talking about where the pain generator is from the facet joints, and this joint look arthritic from the bony changes. There is a needle inserted into the joint area, and actually this first one is to the skin to numb, and then this is into the joint area, and the medication was injected and killed the red flaming flashing light, meaning that the pain is taken care of and it's eliminated.
Great. So that's how the facet blocks are done.
Generally, yes.
And it's similar to whether it's a cervical spine or a lumbar spine?
In essence, yes, but it's different positioning for the patient to get to the lumbar versus the cervical, and each professional have their way of doing it different than others, but that video was essentially correct for what we do.
Fair enough, doctor. Thank you.